Good evening, everyone. I'd like to thank you for coming. I'm going to give you a short presentation on behalf of Canterbury High School and the athletic department on our return to school and return to play for fall sports of this year. My contact information is listed on this slide. I'll also pull that up for you at the end of the presentation. So we're going to start off with just a little bit about COVID. I'm sure most of you are very familiar with it, but I just pulled this off the Johns Hopkins Medicine website and just gives you a quick overview of what COVID is. And we know it can be severe and it has caused death and prolonged illness. Right now, we're on one of the many variants of COVID. It seems to be getting less virulent and more contagious. But in good news, it seems to be primarily in the upper respiratory system now and not going down deeper to where it was causing severe breathing and other complications, leading people to be on ventilators and such. So it does look like it's trending toward a more mild illness. With that said, we still want to be cautious and take as many precautions as we can. So if we look just at the case rates in Harris County, where we're located, and see just a few statistics, and this just has to do with how many people are inpatient at the hospital. You can see that the hospital system is not being overflowed with COVID patients like it was earlier on in the pandemic, which is a good sign. Here's some stats, US statistics with respect to just COVID in children. Number of total cases, overall rate. But again, just a little background information so we can kind of paint an overall picture of what's going on. And here are the current CDC recommendations. So at the local level, based on our current rates in Harris County, the recommendations are as following: to wear a mask indoors, in public, and on public transportation, to stay up to date with the vaccines, get tested if you have symptoms, and if you are at high risk for severe illness, consider taking additional precautions. And with that said, just to make one further point is, even though this illness has been more deadly for older adults and people with underlying medical conditions, we know that some children have underlying medical conditions. They may have asthma, they may be diabetic, they may have chronic lung disease, they may have sickle cell disease, or be immunocompromised. If that's the case, we want you to follow the guidance from your physician. And if we need to, we can coordinate together to make sure that we do the best possible job in caring for that child. So I want to talk just a little bit about the importance of school and athletics. Schools and athletic programs are a critical part of the infrastructure of communities. They provide safe, supportive learning environments, in addition to providing children and adolescents with the opportunity to be healthy and active. There are also important mental health benefits. To name a few, the socialization that occurs with friends and coaches and the structured routine is beneficial to the children. And these combined psychological and physical benefits support developmental growth. It should also be pointed out that physical activity and exercise has benefits for the immune system. Some further benefits of athletics and exercise are improved health, There has been some studies that have shown that children that participate in sports are more likely to stay active in adulthood. Improved mental health, decreases in anxiety and depression, improved cognition, so better at maintaining focus, and also social engagement, which is athletics providing opportunity for social engagement and developing friendships. So this is a brief overview of kind of the highlights of the comprehensive plan that we've put together. And we're going to go over some of these in more detail, but basically we're taking into account a lot of factors in order to mitigate as much risk as possible. So those being vaccinations, testing, keeping children home when sick, encouraging hand washing, cleaning and disinfecting, masking indoors, reporting and contact tracing, and our daily athlete symptom checker. So what we've done is we've created a COVID-19 portal, and we based this on a corporate model from a local company that went back to in-person work in early 2020 when most people were still working virtually. So this is something that they did, and it was successful within their company at managing all the different pieces of COVID and the information. So from the portal, the parents and the students will be able to access all the information. So it's going to tell you what to do when you test positive. There'll be forms that you need to complete for contact tracing. It's going to explain what close contact is. There's also a place to upload your vaccination card. There's the daily athlete symptom tracker, which I'll go over, and then just the overall return to school and play guidelines. As far as parent responsibilities, we are going to ask that our parents help us mitigate risk by doing the following things. So we want them to upload the child's vaccination cards into the portal, keep sick children home, and then test your child if he or she has symptoms of COVID-19. Err on the side of caution on this. And then access the portal for specific instructions on what to do if your child tests positive or has had close exposure to someone else that's tested positive. So quick information just about vaccinations. So the American Academy of Pediatrics recommends that all people who are eligible receive the primary series of COVID-19 vaccine and the booster when recommended, and follow the mitigation recommendations from the CDC. So in the state of Texas, we cannot require that students are vaccinated, but we strongly encourage it. So no one will be withheld from athletics, but again, we recommend that the parents follow the CDC guidelines. The testing. So we really are asking for parents and students to stay vigilant. If your child doesn't feel well, please, please, please test them before sending them to school or practice. I've attached a link here for the most current symptoms of the most recent variant from the CDC. Also wanted to point out that drive-through testing is available at Walgreens, at CVS. Home tests are widely available. There's a link here for Amazon. There's also a link to the free at-home COVID tests from the government. So now we're going to move into what to do when you have an athlete student that tests positive. The first thing we want to happen is to notify the athletic training office within 24 hours, but really as soon as possible. Once that first notification is made, you'll receive an email. We have an email template that directs parents to the portal and also gives them instructions on everything that they need to do. Okay. And then once you get into the portal and you look at the forms that we're requesting from you, you want to complete and submit those forms via the portal. And then we want the athlete that tested positive to quarantine for 5 days. And just keep in mind that 5 days from the positive test date, the day that your child tests positive is day 0. So day 1 starts the day after that. And then after 5 days, if they haven't had a fever without the use of medicine and symptoms are better, they can return to school and practice. So contact tracing, as mentioned, there are forms on the portal that you can fill out. But what we're looking for is for the student athlete to provide us with a list of those that they have been in close contact with. There is a form on the portal that goes over exactly what close contact is, but essentially you're within 6 feet of an individual with confirmed COVID for 15 minutes or more, or you've had direct bodily contact. So in some sports that will have happened, football, wrestling, even basketball and soccer to some extent, you may be very close to someone. The athletic department, my office will contact all the potentially exposed students. So all you need to do is fill in the form of close contacts. You don't need to reach out to anyone else. The school will do that. And if it's deemed that the exposed student was within close contact, then that person will just need to monitor symptoms. And then parents, again, if they start to have symptoms, we want you to test them as soon as possible and keep them home if they're ill. So these are some school-wide mitigation efforts, and these were things that we felt like we needed to do in order to open and create a safe environment for return to school and sports. So what we're doing is we're requiring masks inside. So the only exceptions to that are students that are participating in physical education, band, or athletics. For physical education and band, we are spacing people out to reduce exposure. All visitors will have to wear a mask while indoors. Teachers and coaches will also have to wear masks while indoors. We have increased our cleaning and disinfecting. We're also posting hand washing signage in the bathrooms and throughout the school. Desks will be spaced 6 feet apart, and an outdoor lunch area will be available, weather permitting. So these are our athlete-specific mitigation efforts. And we wanted our student athletes to take on some of the responsibility for mitigating exposure. So what we're going to do is break our athletic teams into pods by sport. And each pod will be encouraged to restrict unmasked contact with anyone outside the pod. This will reduce exposure, promote teamwork, and make contact tracing more efficient. The next slide is just going over another athletic specific mitigation, which is the athlete daily symptom track. This tracker is a form you can find on the portal. It can be completed online. It's a quick series of questions we want the athlete to complete before practice or participating in a game. And any athletes that have symptoms that aren't feeling well, we ask that they're going to stay out of practice that day, stay home, and get tested and make sure that everything's clear before they return. So our expectations with this is we feel like we have a well thought out plan. As mentioned, we did consult with some local a local company that successfully reintegrated in-person work early on in the pandemic. We also contacted some local pediatricians and some individuals from the local med center. So we feel like we have a comprehensive plan, but we know that there's going to be bumps along the way. And we just want to make sure that we're open to working together. We want feedback. We encourage feedback from the coaches, from the parents, from the students, so we can make adjustments and fine tune along the way. If any additional strategies need to be put in place, we will notify parents and students and update the portal. And if conditions change at the local level and we deem the risks of COVID-19 are too great to continue athletics, we'll make that announcement and that decision at the time. And then really just want to open up the floor for questions. If you don't have a question right now, but think of one later, feel free to call the office or send me an email and we'll get back to you and discuss. I really just want to thank everybody for their time tonight, and we're looking forward to a good fall season. Thank you.